Ever given your elbow a good whack and then noticed, a strange soft lump kind of bubbling up?
Mm-hmm.
Maybe it's a bit tender, maybe not. And you might have thought, huh, what on earth is that?
Yeah, happens all the time.
Well, you've definitely landed in the right place today. On the deep dive, we're zeroing right in on that exact thing, Olecranon bursitis.
Yeah, it sounds complicated, but it's surprisingly common.
And we've basically distilled a whole load of information down into what you really need to know. Think of this as your streamlined guide, the crucial bits, without getting totally lost in the weeds.
Exactly. We're aiming to explore it from, top to bottom.
We are.
We've looked at, well, everything from what it actually is, what causes it, right through to how it's diagnosed, treated, and what the outcomes look like. The goal is just to give you a really clear picture.
Perfect. Okay, let's get straight into them. Olecranon bursitis. In plain English, what is it?
Okay, so in simple terms, it's an inflammation or swelling of the olecranon bursa.
Right.
Now, you need to think of the olecranon bursa as this small, sort of slippery cushion. It's filled with fluid.
Okay.
And it sits right at the pointy bit of your elbow over the bone you can easily feel at the back.
Gotcha.
When this little cushion gets irritated, it fills up with extra fluid, and that's what causes the swelling, and often some tenderness too.
So it's almost like a built-in elbow pad that sometimes overinflates.
Exactly. That's a great way to put it. Its job is basically to help the skin glide smoothly over that bony elbow tip when you move your arm.
Right.
But when it gets inflamed, that extra fluid builds up, leads straight to the bursitis, common triggers, leaning on your elbows a lot, repetitive movements, or, like you said, a direct hit to the elbow.
And what would someone notice?
Usually swelling, maybe some pain, and sometimes even warmth and redness in that area.
Sure.
And interestingly, it does seem to show up a bit more often in middle-aged men.
Middle-aged men, noted. Okay. So what makes this protective little sac, go haywire? What are the usual culprits, the causes?
Well, we can broadly group the causes. Makes it easier to think about.
Okay.
First off, there's trauma, like a direct blow or injury to the elbow. Simple enough.
Bang.
Yeah. Then there's repetitive pressure or friction. That can do it too. Like from constantly leaning on your elbows, maybe at a desk or during certain hobbies.
Makes sense.
Infection is another big one. And finally, certain inflammatory conditions, things like gout and rheumatoid arthritis, they can also trigger Olecranon bursitis.
Okay, infection in that elbow sac. That sounds pretty nasty. What kind of bugs are we talking about here? This feels key for treatment. Right?
Oh, absolutely vital. You need to know what you're fighting. So the most common culprit in septic Olecranon bursitis, that's the infected type, is Staphylococcus aureus, often just called Staph aureus.
Staph, right. I heard of it.
Yeah. Following that, we often see streptococci, or strep.
Okay.
Less frequently, especially maybe in people with weaker immune systems, you might see fungal or mycobacterial infections, a bit rare. And then there's some other less common bacterial possibilities to just keep in the back of your mind. Pseudomonas, Enterobacter glomerans, Enterococcus faecalis, Haemophilus influenza, and even E. coli. So yeah, quite a rogues gallery of potential microbes.
Okay, wow. So staph and strep leading the charge mostly, but a few other potential troublemakers lurking.
Yeah.
Got it. So who's more likely to get this elbow issue then? What increases the risk?
Several things, yeah.
Yeah.
As you mentioned, that repetitive or prolonged pressure on the elbow, that's a big factor. If you've had previous injuries to your elbow, you're also at a higher risk. Makes sense, right? Weakens the area, perhaps.
Yeah.
Then there are those underlying conditions like rheumatoid arthritis and gout. They definitely make you more susceptible.
Okay.
And having a history of skin infections around the elbow can also be a risk factor because those infections can sometimes, track down into the bursa.
Ah, okay. So it's not just random chance. There are factors that make you more vulnerable. Now, if we zoom in like under the microscope, what's actually happening? What's the process?
Well, at its heart, it's just inflammation of that olecranon bursa. Simple as that.
Okay.
And this inflammation can be set off by, well, the things we've talked about. Trauma, repeated stress, an infection getting in there, or even as a knock-on effect of those other medical conditions.
Right.
And the main result of this inflammation, it's the buildup of fluid within the bursa. This extra fluid is what causes the swelling and that bump you can see and feel. It's kind of like your body's reaction to irritation at that specific spot.
Fluid buildup. Yeah, that makes sense with that sort of squishy feeling people describe. Now, if someone does have a swollen sore elbow, how do we know for sure it's Olecranon bursitis and not something else? What else could be masquerading as this?
That's a really important question. you've got to consider other possibilities. Several conditions can look pretty similar.
Like what?
Well, arthritis, both rheumatoid and osteoarthritis, can cause elbow pain and sometimes swelling. Gout can cause sudden, really severe inflammation in joints, and the elbow is definitely when it can hit.
Right.
Cellulitis, that's a skin infection. It can also lead to redness, warmth, swelling. But it usually affects a wider area of skin, not just confined to the bursa itself.
Ah, okay. Spread out more.
Exactly. And we also need to think about just other types of soft tissue infections around the elbow more generally.
So it's crucial to look at the bigger picture and not just focus solely on the bump itself. Are there any other health problems that often sort of crop up alongside Olecranon bursitis? The notes mention associated conditions.
Yes, and being aware of these can be really helpful clinically. We definitely see Olecranon bursitis more often in people who have diabetes mellitus,
Okay.
rheumatoid arthritis, and gout, as I've already touched on. Interestingly, it's also more common in individuals with HIV, alcohol dependency, chronic kidney disease.
Really?
Yeah, and also those who are on medications that suppress their immune system, immunosuppressive treatment.
Wow.
So sometimes that elbow issue might actually be a clue that there's another underlying health concern that needs looking into.
That's a really key point. It's not always just an isolated elbow thing. Now, let's zoom out again. Thinking about the UK specifically, how common is this condition?
Here in the UK, Olecranon bursitis is, well, it's fairly common across all age groups, actually.
Right.
The estimated incidence is somewhere around 1 in 10,000 people each year. Gives you a rough sense of scale.
Okay, not insignificant.
No. And it's seen more frequently in men and typically in young to middle-aged adults.
Uh-huh.
We also see it more often in people doing certain jobs. Think gardeners, mechanics, people who regularly put pressure on their elbows.
Right, the leaning professions.
Exactly.
Yeah.
And it's also more common in certain sports, either those involving direct stress on the elbow, like baseball, cricket, weightlifting, or sports with a higher risk of falling onto the elbow. Think hockey, rugby. So yeah, activities involving leaning or potential impacts are definitely key.
So if your weekend involves competitive gardening, followed by a quick game of rugby, maybe invest in some elbow pads.
Probably a good idea.
Okay, let's get down to the nitty-gritty then. What someone might actually feel and what a doctor would see. What does Olecranon bursitis typically look and feel like?
Well, the most obvious sign is usually that swelling right at the back of the elbow. It often feels quite soft, like a fluid-filled sac.
Squishy.
Yeah, squishy is a good word. And it can be tender when you touch it. You might also find it a bit difficult to move your elbow fully, but that's often just because of the swelling and the discomfort rather than a joint problem itself.
Okay.
Warmth, redness, and pain are also pretty common. And the pain often gets worse when you put pressure on the elbow, like leaning on it, or when you move it.
And what about the story behind it, the history? Any clues there?
Often people will describe a gradual sort of development of swelling at the back of the elbow. It might even have started without any pain at all initially.
Really? Painless at first.
Sometimes, yeah. The pain might come on later, and it's often made worse by leaning on the elbow, like sitting at a desk. So you might remember a specific injury, a knock, or maybe a repetitive activity that seemed to set it off.
Okay.
But importantly, if that swelling comes on really suddenly and there's no clear injury, that should definitely make you think more strongly about a possible infection.
Sudden swelling without injury, red flag for infection. Got it. And what would a doctor look for when they examine the elbow?
Right. So on examination, the classic finding is that distinct swelling right at the tip of the elbow. Sometimes it's described as looking like a goose egg.
A goose egg, okay.
Exactly. There might be tenderness when you press on it, and if there is an infection brewing, you might also see that redness and feel warmth in the area. Generally, the actual movement of the elbow joint itself will be pretty normal, although bending the elbow fully, end-range flexion, might be limited and painful just because of the tense swelling. But if there's a significant restriction in movement, especially after an injury, that's when you need to start thinking, could there also be a fracture?
Right. And what are the specific signs that would really push you towards suspecting an infection?
Key indicators for infection would be significant pain that seems to be getting worse, not better.
Okay.
A bursa that feels properly hot to the touch, rapidly increasing swelling, redness that's starting to spread beyond just the bursa itself, that's cellulitis.
Right, spreading skin infection?
Exactly. Any breaks in the skin around the elbow are also a worry, and potentially even a fever, feeling generally unwell. These are all important warning signs.
And you mentioned thinking about a fracture after an injury. What specifically suggests that possibility?
Well, if someone has significant elbow pain during any movement, not just at the end range, especially after a fall or direct hit, that raises the suspicion for a fracture.
Ah.
Also, if the swelling seems to be all around the entire elbow joint, rather than just localized at the tip over the bursa, that might suggest a different underlying joint problem.
Good points to keep in mind. And the notes mention checking other joints. Why bother doing that?
Yeah. Examining other joints is important because it helps you look for signs of systemic conditions. Things like gout or pseudogout, where you get crystals forming in multiple joints.
Okay.
Or to identify systemic inflammatory conditions, like rheumatoid arthritis, which can sometimes present with inflammation in multiple joints, including the elbow bursa. It just helps you see if the elbow issue is part of a bigger pattern.
Right, context is key. Okay, so we've covered the symptoms, what to look for. How do we actually confirm it's Olecranon bursitis? What tests or investigations might be needed?
Well, in many cases, probably most, we can actually make the diagnosis just based on the patient's story, medical history, and a good physical examination.
So, often clinical.
Often clinical, yes. However, sometimes we do need to do some further investigations, either to confirm the diagnosis if there's doubt, or to rule out those other conditions we talked about.
Like those lab tests, blood tests.
Exactly. We might order blood tests, like a white blood cell count, to see if there are signs of infection fighting. We might check uric acid levels if we suspect gout is playing a role. Maybe a rheumatoid factor test if rheumatoid arthritis is on the differential list. And those inflammatory markers like ESR and CRP, they can give us a general idea of how much inflammation is going on in the body.
Okay, what about imaging? Scans. When would you use an X-ray or an ultrasound or maybe even an MRI?
Right, so an X-ray is usually done if there's been a significant injury like a fall into the elbow, mainly to check for a fracture, rule that out.
That makes sense.
Ultrasound can be really useful if we're not totally sure about the diagnosis just from the exam. It's great for actually seeing the fluid collection in the bursa,
Okay.
checking for any thickening of the bursa lining, and it can sometimes spot calcifications too. MRI is, more detailed scan. It could help confirm the diagnosis and can be particularly useful if you're trying to rule out an infection like osteomyelitis nearby, but it's definitely not always needed as a first step, more for complex cases.
Okay. And then there's that aspiration procedure, drawing fluid out of the bursa with a needle. That sounds pretty important, both for diagnosis and potentially for treatment.
Absolutely. It's a key procedure. It serves two main purposes. Diagnosis, especially if we suspect septic bursitis.
Right, the infection.
Exactly. And it can also provide symptom relief. By removing that excess fluid, it often reduces the pain and the swelling quite significantly.
How's it done?
We use a completely sterile technique, of course, usually with a relatively small needle, maybe an 18 or 20 gauge. And we typically approach from the side, the lateral aspect, to make sure we avoid the ulnar nerve, which runs nearby.
Okay, important safety point. And what can you tell just by looking at the fluid you draw out? Any quick clues there?
Oh yeah, the appearance of the fluid can give you some immediate hints. If it's sort of straw-colored, clearish yellow, that's often seen in non-infected inflammatory cases. If it's cloudy or looks like pus, well, that strongly suggests an infection.
Right, pretty obvious.
Blood-stained fluid might point towards trauma, or it could be seen in conditions like rheumatoid arthritis, gout, or even sometimes in an infected bursa. And a sort of milky appearance can be a sign of gout or pseudogout because of all the crystals floating around.
Fascinating. And then you send that fluid off to the lab, presumably, for microscopy and culture.
Exactly right. The fluid we aspirate is sent straight to the lab for further analysis. They'll do gram stain to look for bacteria immediately, then culture it to grow any bacteria present and do sensitivity testing.
To see which antibiotics work.
Precisely. Tells us which antibiotics will be most effective. And importantly, they also look at the fluid under a microscope, specifically looking for crystals. That can confirm a diagnosis of gout if we see those needle-shaped monosodium urate crystals or pseudogout, if we see the calcium pyrophosphate or hydroxyapatite crystals.
Wow. So yeah, a lot of crucial information can be gleaned from that little bit of elbow fluid. Okay, now let's switch gears to treatment. What do you actually do to treat Olecranon bursitis here in the UK?
So the treatment really hinges on whether the bursitis is infected, septic, or not non-septic. That's the main fork in the road.
Okay.
Generally, though, for most cases, the initial steps involve the good old RICE principle.
RICE.
Yeah, R-I-C-E. Rest, ice, compression, like with a bandage, and elevation, if possible.
Got it. Rest, ice, compression, elevation.
Exactly.
Yeah.
We also often recommend non-steroidal anti-inflammatory drugs,
Mm.
NSAIDs, things like ibuprofen, to help with pain and inflammation.
Standard stuff.
Pretty standard.
Yeah.
Now, if we suspect, or even better, confirm an infection, then antibiotics are absolutely essential.
Right.
In some more severe or persistent cases, the ones that just don't seem to settle, we might consider doing repeated aspirations to drain the fluid, or sometimes even surgical removal of the entire bursa sac. That's called a bursectomy.
A bursectomy, okay.
Yeah.
And just focusing on those non-infected cases for a second, what's the usual step-by-step approach?
Okay, so for non-septic bursitis, those conservative measures, rice, are usually the first line. Get the inflammation down.
Yeah.
Pain relief with paracetamol or NSAIDs can help manage the symptoms, make you more comfortable.
Mm-hmm.
As we discussed, draining the fluid via aspiration can relieve that pressure and discomfort quite quickly.
Instant relief sometimes.
Can be, yeah. And sometimes at the same time as aspiration, we might inject a corticosteroid directly into the bursa. That's a strong anti-inflammatory to help calm things down right at the source.
Okay.
And very occasionally, if there's maybe a little bony spur on the olecranon that seems to be constantly irritating the bursa, surgical removal of just that spur might be considered, but that's less common.
Right. And for the septic cases, the infected ones, it sounds like a more aggressive approach is needed straight away. What's the management plan there?
Yes, septic bursitis needs prompt, serious treatment with antibiotics. No messing around. We usually start with what we call empirical antibiotics,
Meaning?
meaning antibiotics that cover the most likely bacteria based on what we know usually causes these infections, like that Staph aureus we mentioned. We start these while we're waiting for the lab results from the fluid culture.
Okay, cover the bases first.
Exactly. Examples of antibiotics we might use initially include flucloxacillin or maybe erythromycin if someone's allergic to penicillin.
Right.
Then, once we get those culture and sensitivity results back from the lab, usually after a day or two, we can then adjust the antibiotics if needed to specifically target the exact bacteria that's been identified. Make sure we're using the best weapon.
Tailoring the treatment.
Precisely. And in some cases of septic bursitis, especially if the infection is really severe or if it's not responding well to the antibiotics alone, surgery to properly drain the infection might be necessary.
Okay, so treatment options are quite broad, from simple rice-E at home to antibiotics and even surgery in some cases. Generally speaking, what's the outlook? What's the prognosis like? And maybe more importantly, how can people try and prevent this from happening in the first place?
Well, the good news is that the prognosis for Olecranon bursitis is generally pretty good, provided it's managed appropriately.
It's reassuring.
Yeah, most cases will resolve within a few weeks to maybe a couple of months.
Yeah.
However, it is possible for it to come back. Recurrence can happen, especially if there are underlying causes that aren't addressed, like gout, or if you continue with that repetitive trauma or pressure on the elbow.
Right, gotta fix the root cause if there is one.
Exactly. And prevention really just focuses on trying to avoid that excessive pressure and direct trauma to the elbow tip. So if you're involved in activities or work that puts your elbows at risk, wearing simple elbow pads can actually be a really effective way to protect them.
Simple but effective. So mostly positive news on the recovery front, but definitely something you'd rather avoid if you can help it. Finally then, what are some of the potential downsides? The problems or complications if Olecranon bursitis isn't treated properly or maybe in the more severe cases?
Thankfully, serious complications are relatively uncommon. It usually behaves itself,
Good.
however they can happen. Complications could include the infection, if it's present, spreading to nearby tissues. The bursa might just remain swollen, problematic for a long time, chronic bursitis. And in people with those underlying conditions we mentioned, it could trigger flares of their gout or rheumatoid arthritis.
Okay.
There's also always a small theoretical risk of accidentally introducing a secondary infection during the aspiration or injection procedures, although we take great care to avoid that with sterile technique.
Right, unavoidable small risk.
In more severe cases of septic bursitis, the really nasty ones, we could see much more serious issues like septic arthritis. That's an infection getting into the actual elbow joint itself.
Oh, wow.
Sepsis, which is a dangerous widespread infection throughout the body, or even osteomyelitis, an infection settling in the underlying bone.
Serious stuff.
Very serious. And very rarely you might get abnormal connections forming between tissues called fistulae. And, in some really difficult to treat, stubborn cases, people might unfortunately end up with persistent pain and reduced ability to use their arm properly, decreased function.
Okay. So while it's generally manageable, it's definitely not something to ignore, especially if you suspect an infection might be involved. Right, let's quickly recap the key takeaways about Olecranon bursitis.
Great idea.
It's that swelling at the back of your elbow, the goose egg, often caused by leaning, bumps, direct trauma, or sometimes linked to other health issues like gout or rheumatoid arthritis.
hmm Remember, infection is a serious possibility. Septic bursitis with Staph aureus being the most common bug.
Right, and diagnosing it often involves a good clinical examination, but sometimes taking a fluid sample from the bursa aspiration is key for figuring out if it's infected and what type it is.
And treatment spans from simple rice rest, ice, compression, elevation, and maybe NSAIDs, through to antibiotics if it's infected, and sometimes injections or even surgery.
And while most people recover well, preventing that pressure or trauma to your elbow is definitely a good strategy. So hopefully next time you or someone you know notices that funny bump on the elbow, you'll have a much clearer idea of what might be going on.
Yeah, definitely demystifies it a bit.
It certainly makes you think twice about those leaning on your elbows habits, doesn't it?
It does. Or reminds you to pack those elbow pads for rugby practice.
Exactly. Now, for more in-depth learning and fantastic revision resources on this and honestly loads of other crucial medical topics, make sure you check out pastthemsra.com and also freesra.com.
Great resources.
They really are. Thanks so much for taking this deep dive into Olecranon bursitis with us today.